Hi everyone. So today's topic will focus on Cushing syndrome. This was a topic where I used to struggle a lot to understand the dexamethasone suppression test a lot. I used to not understand it, so I used to do revision for like 4 or 5 times to just understand the concept about this drug test and how can we differentiate it. So today we'll focus on that one, and this was a hard topic for me when I was doing my MBBS. And if you have any other topics which is hard for you as well, you can mention in the comments, and or you can DM me. I'll try to make it as easy as possible, and if you don't understand this one also, just mention in the comments. I'll try to explain you in as simple way as possible. Okay, let's go into it. So Cushing syndrome. So Cushing syndrome is nothing but how the patient looks. So if a patient has a defined Cushingite symptoms, that says it's a Cushing syndrome, like hypertension, weight gain, moon face, abdominal striae or truncal obesity, buffalo hump, skin changes like thinning and hirsutism, hyperglycemia or amenorrhea, and immunosuppression, and many more. So that defines Cushing syndrome. So it includes tumor from anterior pituitary, adrenal cortex, and small cell lung carcinoma. Also the Cushing syndrome. The Cushing disease is only ACTH secreting tumor from anterior pituitary. This is specifically from the ACTH secreting from anterior pituitary. Okay, so let's go into this dexamethasone suppression test. So normally when you give a dexamethasone to a normal healthy person, it gives a negative feedback to the hypothalamus and anterior pituitary. With that, it decreases the ACTH and decreases the cortisol in a normal healthy person. So this specific test is done only when they have an endogenous Cushing syndrome. Endogenous means something which is produced within the body. Exogenous is something which is taken from external, like medication. So if you take medication also, same like dexamethasone, your levels will be decreased, ACTH and cortisol. So there is nothing much that can help us to identify the exogenous cause. So it is not applicable to the exogenous, only for the endogenous. So let's go into it. So low dose of dexamethasone, it abnormally increases the cortisol. So that says that the patient has Cushing's syndrome. It just defines that patient has Cushing's syndrome, but don't know exactly like from where the tumor is or from which location it's producing. We have no idea about it. It just says that the patient has Cushing's issue. So low dose of when you give low dose of dexamethasone, there'll be increase in the cortisol. So next you need to do the high dose of dexamethasone. So this helps us to differentiate between Cushing's disease and Cushing's syndrome. So when there is a decrease in a cortisol, that says that it is a Cushing disease. So normally when you go for diagnosis of Cushing disease, there will be increase in ACTH and increase in the cortisol. As you know that it is an ACTH secreting tumor, so your ACTH will be high and it follows with the increase in the cortisol. This is the normal criteria for diagnosis for Cushing disease. So when you give a high dose of dexamethasone, there will be a decrease in a cortisol and decrease in a ACTH. Okay, and if the cortisol is high, we'll look for ACTH levels. If the ACTH is low and increase in the cortisol, it is an adrenal cortical adenoma. We also call this one as ACTH independent Cushing syndrome, it is independent of ACTH. That's why we call it as ACTH independent Cushing syndrome. And the other one is if there is another scenario, if there is an ACTH is increased and increase in the cortisol, we say it is from the small cell lung carcinoma. So we call this one as ACTH dependent Cushing syndrome. As you see that it is dependent on ACTH. So this is the simplest possible way that I can explain you. Here you can clearly see, you can able to differentiate between Cushing disease, which is secreted from the pituitary gland, and this one is from the adrenal cortical adenoma, and this one is the small cell lung carcinoma. So these are the three things which will help you to differentiate with this drug test. Please let me know if you didn't understand it. I'll try to come it in a more simple way, or if you want me to go in depth regarding this topic, like about the symptoms, about the diagnosis and everything. Please let me know in the comments, and I'll be looking forward to hear from you guys. Have a good day. Bye.